Hi, I'm here because I have some acne scars and some little, depressions and stuff, and my skin isn't that nice. I used to have nicer skin, but going through like puberty and stuff, it changes. I came across Dr. Emer and just very impressed with the results that I've seen from others. I'm a very confident person. It's really gonna help me because sometimes in certain lighting, I don't like seeing depressions and like pits and stuff. It makes me a little insecure, but we're gonna get it fixed.
We are here today doing some Bellafill. We're doing a combination treatment for my patient that has acne scars. These irregular, deeper scars that I can put filler into. What I'm trying to do right now is use a little needle subcision and use this Bellafill. We call this the spiderweb filler. This is PMMA that's with collagen that's going right under those scars. So now we're gonna start subcision, and this is where we use a cannula under the skin in this area of irregular texture, and we kind of break the scar. Now, normally I'm putting a bunch of fluid in here. Right now I'm trying not to do that because I just did a really good improvement with Bellafill, and I'm gonna go under that Bellafill. We need to go deep, so we're gonna use this pixel, and it's not the best feeling in the world, so that's why we did some nerve blocks. A couple passes we're gonna do. When you're doing deep microneedling RF with a laser, you wanna go lower than 1.5 millimeters. If you're doing it with just microneedling, you're not going to see a result. If you're doing it with deep RF, we're talking 2.5 to 3 millimeters minimum. So we're doing CO2 resurfacing with our Aurora Phoenix, and you guys can see the scanning, high density. You see that frosting or that what we call char. That is the coagulation that's occurring with the laser. This is working really strong to resurface his acne scars, and it's also just going to overall improve his texture, color, and pores.
Hey guys, Jonathan here. We just finished doing some of the ablative laser. Right now we are applying some PRP, which is some plasma to help the area heal much faster. So right now we're getting ready to do a recovery mask, which is our biocellulose mask. This is going to help heal the area right after the ablative lasers. Right after our ablative lasers, we have to make sure that the skin heals and repairs and it gets the right type of moisture. So right now I'm gonna do oxygen over it. So the mask is made out of a special material, which is biocellulose. Basically, the mask has small little perforated holes that's allowing oxygen to penetrate through the mask, which is then going to help hydrate and repair the skin.
I think he did an awesome job with the way that he covered everything, and he went over certain areas with a stronger laser. Like, he's doing everything to make it look good when it heals, after it heals. And I really like that he gave me the medicine that I needed so I wouldn't feel any pain. I didn't feel pretty much anything. It was very tolerable. And he really does make sure that you feel comfortable when you're getting something like this done, because it can be like painful with other people, but he takes every approach to make it, painless for you. And I really appreciate that. It is day 2, and really it's not that much pain. It's just that my skin is very tight, and I'm being very careful about not talking too much so that I just don't want it to tear anything, so I'm just being very, very still. But overall, can't wait to see the end result. Is pretty good, and I felt that he would be an awesome doctor, and he really surpassed it. I mean, I didn't feel any pain the first time or anything. People are asking me every day, what did you do? What did you do? What's your secret? Who'd you go to and stuff? So I'm coming back for round 2. He's extremely effective. And somebody once told me, they're like, oh, he might be a little aggressive, but I actually think he can control the strength of everything to get it going, get it where you're not going in so many times. I mean, twice it's gonna be perfect.
You